So, as this topic of obesity is being discussed today, this is an extremely important topic because not only it causes harm to various organs of the body and causes problem, mortality, morbidity, but also that it is also treatable. So, something which we have to look for things which are treatable, which are correctable, and then we can focus on that. So, if you see the the studies have shown that almost 1/3, even in some urban area, 40% of population is obese. In a rural area, also about 20% they are obese. These are the current figures for India. So it's a very big number. That is what we need to understand. Then the common thing, what people ask you, what is obesity? People ask, what is obesity? How to know I'm obese or not? So there are certain very simple things to remember. The most accurate way is, the body mass index. And these days, apps are available. You can download an app on your phone, just enter your height and weight, and you will get a body mass index. And body mass index should be preferably less than 23. 18 to 23 is thought to be normal. And certainly less than 25, because Western population, they take 25 as cutoff, but we take 23 because we are more prone to obesity-related problems. So, a very general rule of thumb that previously used to be said about obesity, you take your height in inches. Suppose you are 5 feet tall, so your height in inches, 60 inches. So, the weight should be around 60 only. It's a very easy thing. If your height is 70 inches, the weight should be approximately 70. So, a very gross rule of thumb which is there, which also is useful. It's easy to remember, and therefore one can easily apply also. And then there is also a method, waist circumference. There's a waist circumference, that's also a good index. Everyone knows their trouser sizes, etc. So for men, it should be less than 40 inches. And for women, it should be less than 35 inches. So it's again very easy to remember. 35 and 40 inches your waist should be less than that. And in centimeters, it comes to around 90 centimeters and 100 centimeters. So it's just that one should remember. So, and especially if you see there is a condition called metabolic syndrome, which has, various these lifestyle disorders like diabetes, hypertension, and that has obesity, that has waist circumference as a definition in that. So that is what is kind of, important. And different studies have also shown that it's the abdominal obesity. It's that increase in the waist, which is more important as compared to the overall weight, because if the weight is more around hips and thighs, etc., that is less harmful as compared to weight that is around in the abdomen, like a protruding tummy. That is what is harmful, and therefore this has to be kind of looked at more carefully. So then the various organs of the body get affected, various diseases get affected by it, and I'm going to focus more on heart diseases and cardiovascular problems. And there are two certain things are hypertension, that is high blood pressure, and of course coronary disease, which is like angina and heart attacks, mitral infarctions, etc. So very often we see the patients who have got high blood obesity, when they reduce their weight, their blood pressure comes down. This is well documented. This is one thing which we advise to all our patients who have got hypertension, that they should attain an ideal body weight. With that, the requirement for drugs go down. Sometimes they don't even need any drug at all for if the hypertension is not very high. So, and that's an important thing. Secondly, this obesity is often associated with high cholesterol in the blood, and that leads to atherosclerosis, coronary atherosclerosis, and that leads to angina and heart attacks, etc. So therefore, that's as everyone knows that angina, heart attacks is a very major problem. It leads to significant morbidity, mortality, and this also leads to heart failures. So patient heart failure we advise them to attain an ideal body weight, because more the weight, the more is the load on the heart. The heart has to pump that extra volume of blood for every extra kilogram of the body. And therefore, it's important to control the body weight for that. In recent years, even the rhythm problems of the heart, something called atrial fibrillation, that is also becoming more common. That is, especially with our aging population, it's more common in elderly, and therefore rhythm problems are there. And there also we have found that those people who manage their lifestyle and they reduce their body weight to ideal body weight, reduce from obesity to ideal body weight, their rhythm problem also goes down. So otherwise, atrial fibrillation is a little difficult thing to treat. So that is the other way. So therefore, there are a lot of things. So I have also on cardiovascular disease, but of course there are other diseases like cancer and diabetes is a very major one, and even social problem. I think subsequently we will discuss even more. So this is in brief about the cardiovascular disease and the effect on the cardiovascular, obesity on the cardiovascular disease. Thank you.
Good afternoon, everyone. A lot has been said about obesity. Now, one thing is that obesity is now considered as a chronic progressive disease. Earlier, it was thought as only a cosmetic problem or something everything needs to be taken care of. Now it is clear and it has been agreed by everybody that it is a chronic and progressive disease which can have ill effects on every organ system of the body. Heart is one, liver, the kidneys, the joints. It can affect every major organ system of the body. And having excess fat in the body, fat mix, that's called obesity. So what is peculiar with our Indian population is that we tend to accumulate fat over the abdomen or the belly, much more than our Western counterparts or Europeans or Americans. So a person of the same age, same BMI, of European descent will have a less body fat as compared to a person who is of Indian origin, or me or you. So that is the problem with us. We tend to accumulate more fat as compared to the rest of the parts of the rest of the components of body composition, and we tend to accumulate more fat at the belly. So that is the major problem with our population. And that is the reason that body mass index, the universally accepted parameter to define obesity, there may be a problem with that, particularly in our population. Because BMI is it is your higher weight divided by height, and that does not take into consideration how your body fat is distributed. A person who has a large amount of belly fat will have a same BMI. On the other hand, an NBA basketball player having everything but having a lot of muscle and just maybe 10%, 12% of body fat will have the same BMI, but that person is not at any risk, whereas the person with high body fat or high belly fat is at a higher risk of developing problems. So that doesn't differentiate very well. And that is the reason that another measure, like as Dr. Narang said, waist circumference. Your waist, how big is your waist? That is a very important parameter to differentiate, because if the BMI is less but your waist is more than the norm of the particular ethnic group, because waist circumference is not same in all ethnicities. Different cutoffs are there in different populations. For Europeans, it's different. For Japanese, it's different. For Indians, it's a different cutoff. So it depends on the ethnicity. And if, as per the ethnic group, if your waist is higher than the cutoff, then you are at a risk of developing problems, even if your BMI may be all right. So that is a very important thing. Another measure is, once you have your waist, so another measure is waist by height. A simple measure. You measure your waist, you add your height, divide your waist by height, it should be 0.5. That is, keep your waist half of your height to remain healthy. Now, if that is there, then
centimeter.
Whatever it is, the unit, whatever. If your waist, you take in inches, take height in inches. If you take it in centimeters, whatever may be the measure, but if you keep your waist half of your height, that's good. Then you will not be at a risk of developing cardiac problem, metabolic problem, and all these sort of things. And that is something which is important. And lately, there has been a paradigm shift in how you define obesity. Like, you must have come across many people. They say, I'm obese as per the BMI, whatever, but I don't have any problem. I feel perfectly healthy. My blood pressure is okay. My lipids are okay. My sugar is okay. I feel energetic. I exercise. Everything is fine. I don't have any problem. But that is a stage. Now with the new definitions, that may be a preclinical kind of obesity. where you are obese, but you haven't developed any clinical problem as of now. But this is a temporary phase, I would say. This does not remain for a long time. Now, over a period of time, this individual, if does not take care about it, can go on to develop clinical problems. So now that is why internationally, as well as the Indian consensus, which has been recently published, that there's one stage where there is a preclinical obesity, the second is the clinical obesity. So in preclinical, you have to be careful. You have to avoid going on to the clinical. And once you develop the problem, then you have to manage it. So obesity is one thing which is a preventable problem. Constitutional obesity is a preventable problem. There are genetic causes of obesity which are seen generally in the children, not in adults. In adults, almost the majority of the problem of obesity is constitutional. It's preventable unless an individual is on some drugs, etc., which may lead to weight gain. So that is why it is a mother of all a large number of non-communicable diseases, even cancers. Several cancers have been associated with obesity. So it is one thing, if you prevent it, manage it properly by your diet, lifestyle, or medications. So lifestyle changes, diet and lifestyle changes are the pillars of management. Everything else, maybe the medications, maybe the surgery, whatever is there, that comes after that. If this pillar is not there, nothing else works. And this is a preventable problem which can lead to prevention of so many non-communicable diseases. And why it is to be taken seriously, I'm glad it is being taken seriously right now, is because our healthcare system, now we are the diabetes capital of the world. Now recently China has more numbers, but we were the diabetes capital of the world. So they had so many patients with diabetes, and incidence of cancer is increasing, incidence of heart disease is increasing. And that too, this is happening in every age group. Now, obesity is seen in every age group: children, adolescents, young adults, elderly. So it's affecting all the age groups, and it is affecting all the socioeconomic status. Rural population traditionally was hardworking, very less prevalence or incidence of obesity, but now it is increasing. You see the reports of National Family Health Survey 4 and 5. There's a significant jump in the prevalence of obesity even in the rural areas. So the changes are happening everywhere. The urban, rural, and the population who are migrants, rural to urban migrants, that is one population which is badly affected, or the so-called slum or urban, the migrants, who a large proportion of them end up living in the urban slums. So that is a population which is exposed to the most unhealthy diet, most unhealthy lifestyle practices. So this situation is happening everywhere, and if it's not controlled adequately or quickly, there's going to be an explosion of non-communicable diseases. And then that may overwhelm our healthcare resources. And this is not something, obesity is not something which needs to be managed only at a tertiary care center or a specialized center. No. It has to be, everybody, even a doctor sitting in a PHC in a rural area should be aware about it. That this is a problem, why it is caused, and how to manage it. And up to a great level, management prevention, management and awareness can be done at that level itself. It doesn't need to be a sole area in the urban cities like Delhi, or a tertiary care or specialized sector. So that is the reason I think awareness of everybody about what causes obesity, how to deal with it, how to prevent it, and how to manage obesity and prevent developing problems later on. I think that awareness is very important, and it's happening at the school levels, at the college levels, even at the general population level. Now that is extremely important.